Since penicillin was discovered 88 years ago, almost every bacteria is becoming resistant to the antibiotic designed to treat it. So-called superbugs are a growing threat, germs so strong they're immune to most or all antibiotics known to man. Just last May, Army researchers were alarmed to discover a new breed of superbug brought into the U.S. from overseas. Today, we look at the risks of superbugs and what the government is and isn't doing about it.
My mom was like this full of life person. She volunteered at the senior center every day. She was very independent.
Debbie Smoody took her mom Elsie to a Pennsylvania hospital last year for a simple outpatient procedure.
This picture right here was the day after the procedure.
The procedure didn't identify any medical issues, but afterward, Elsie went downhill fast. It turns out she'd been infected by the hospital equipment, according to her doctor.
He said that she contracted this bacteria. It was probably from a scope that was not properly cleaned. He also told me that the bacteria that she had was resistant to just about any kind of antibiotic there was, and the chance of her surviving was pretty slim.
That's pretty shocking.
It was pretty shocking. She's like, "I'm dying, do I have cancer?" And I said, "You don't have cancer. You have this bacteria. We don't know." I said, "It's not good." And I told her, you know, there's not antibiotics that really can get you better, but they're gonna try.
Nothing worked. In a matter of weeks, Elsie was gone.
That picture right there is probably the day that she passed away or the day before that she passed away.
What is it you think people should be concerned about?
Superbugs, which are antibiotic-resistant bacteria, are the greatest infection threat in our country right now.
Congressman Tim Murphy heads a congressional subcommittee that's looking into the emerging superbug threat.
Far more people die of infections that can't be treated than people die of AIDS. The other thing about this is it's getting worse. We don't have cures for this, and people better start paying attention.
There are many ways bacteria are becoming immune to the effects of modern medicine. Doctors may prescribe antibiotics too often. Patients may not finish their entire prescription, leaving behind stronger resistant bugs. Heavy antibiotic use in animals can lead to superbugs in meat and poultry, say critics, which can spread antibiotic immunity to other bacteria in people.
Antibiotic resistance is exploding in numbers.
Critics say a CDC awareness campaign that spent millions of tax dollars to discourage antibiotic overuse has done little to help.
Antibiotic resistance is one of the most serious health threats we face today.
And even if antibiotics in the U.S. were better controlled, there's the foreign factor. U.S. residents routinely cross the southern border to buy cheap antibiotics illegally without a prescription and carry them back into the U.S. We sent a producer to Tijuana, Mexico.
¿Cuánto es en dólar?
She had no problem finding pharmacies offering antibiotics for sale without a prescription, no questions asked.
No tengo receta, pero ¿me puedes vender ampicilina or erythromycin? Okay.
3 out of 4 pharmacies we visited didn't ask for a doctor's prescription.
Okay, pero no tengo receta, ¿está bien? Okay.
We went to Mexico and found it easy to get antibiotics without a prescription.
It's easy to do. Then crossing over the border, a lot of our Border Patrol, they're looking for big parts of illegal drugs or the cocaine, the heroin, other things coming across the border. They're not looking for vials of some antibiotics. But it is a problem when you add up the many, many Americans or people who bring them across the border.
I would be concerned when I would hear stories like that because that's exactly how things get exacerbated.
Microbiologist Patrick McGann leads a research team at the Walter Reed Army Institute of Research.
We keep them at minus 80 degrees Celsius. So
where they comb through samples sent from hospitals around the country looking for signs of dangerous superbugs.
So this is from during the Iraq War from 2003 to 2011.
Resistant bacteria caused severe problems for U.S. soldiers fighting in Iraq.
At the height of the war in 2006, there was like nearly 1 new infection every day, and they were extremely difficult to, we still have soldiers to this day that are recovering from some of the infections that they received.
Last May came a bombshell. One of the most feared bacteria, first discovered last year in China, turned up in the U.S.
Each colony represents one bacteria.
It was McGann's lab that found it.
I think I used an expletive when I responded back immediately. Are you serious?
The sample was from a 49-year-old woman hospitalized in Pennsylvania. Her urine contained bacteria with a gene called MCR1 that makes it resistant to our best antibiotic.
So this is the original MCR1 positive E. coli that came from that patient in Pennsylvania. Now that we have globalization, these bacteria will start to be imported into the United States from other countries, whether through food or through animals or just by people traveling, from country to country.
The Centers for Disease Control estimates 2 million Americans a year are hit by hard-to-kill, drug-resistant bacteria. 23,000 die. The actual number could be much higher. The CDC doesn't require hospitals to report superbug infections. Congressman Murphy wants mandatory reporting, but the idea doesn't have enough support to become law.
Hospitals don't want to be known as having an infection in them because people don't want to come, or they don't want to have their insurance rates raised or have lawsuits. Doctors don't want to chart it. The CDC doesn't adequately monitor these things. So all these things add up to we have a big mess.
We asked the CDC why it doesn't require hospitals to report their superbug outbreaks. In a statement, CDC told us it does monitor drug-resistant infections, but has no regulatory power to require reporting because, quote, each state develops its own mandates. The agency says it is taking steps to improve the nation's capacity to detect, respond, and prevent antibiotic-resistant infections. Debbie Smoody has learned a lot about superbugs since her mother's death. She thinks hospitals should be required to report them and warn patients of any outbreaks before they're treated.
To see her go from that to what she became in like a month's time, it blows my mind to this day. Like, I still can't even believe that it all happened.
Last year, the White House released a national action plan for better monitoring and nearly doubled the funding to fight antibiotic resistance to more than $1.2 billion.